Introduction. Diabetes can be caused by a number of things, but what really causes the disease a lot of the times is when there's not enough insulin. Some cells in the body need insulin to take in glucose and other nutrients from food. When food is eaten, the pancreas releases this hormone. High blood glucose levels are a sign of diabetes when the body doesn't make enough insulin. There are two types of diabetes, type 1 and type 2 diabetes. Both types of diabetes are caused by both genes and the environmental factors. If you have diabetes, it was probably caused by a mix of factors from your genes and external factors such as being overweight, not getting enough exercise, and taking certain medicines. Type 1 diabetes is caused by a lack of insulin. What happens here is that the defense system mistakenly attacks and kills insulin-making pancreatic cells, which leads to a lack of insulin. Insulin needs to be in our blood and cells all the time, not just after we eat, but for our bodies to work properly. Insulin is essential for keeping tissues together and stopping them from breaking down on their own. Because of this, people with type 1 diabetes have higher levels of glucose, fats, and protein products in their blood and urine. Type 2 diabetes happens when the pancreas doesn't make enough insulin as it used to, which leads the body to become resistant to insulin. The remaining sections of this book will be aimed at showing you all you need to know to manage or beat diabetes. Chapter 1. What's the difference between diabetes insipidus and type 2 diabetes? The name of the disease diabetes is very interesting. It comes from the Greek word for a siphon, or, in everyday language, a pipe or hose. The Greeks used this name because people with diabetes urinated so much like a water pipe. Patients with diabetes insipidus all have different ways the disease affects them, but a major symptom is that they all have to pee often and in large amounts. Diabetes insipidus happens when the hormone arginine vasopressin, AVP, also called antidiuretic hormone, ADH, which keeps our pee at the right volume and concentration, can't work properly. Dehydration and the loss of calories through pee can cause you to lose weight and feel hungry. Also, when glucose gets into the cells of the eye, it can temporarily make it hard to see. When these symptoms last and get worse, as they often do with type 1 diabetes, our blood chemistry changes in ways that are not good. When paired with being dehydrated, these changes cause dizziness, weakness, and sleepiness. If not addressed, they can lead to coma and death. Both type 1 and type 2 diabetes have been linked to coma and death in severe cases where the disease has not been controlled well. People with type 2 diabetes are older and more likely to have other health problems which can make their diabetes worse. 1 in 4 people with diabetes don't know they have it, so they haven't been identified. Even if there are no signs, it is important to get a diagnosis because even mild diabetes can cause problems and shorten your life. Diabetes can hurt nerves or cause heart problems, which can lead to a wrong diagnosis. In fact, 1 out of every 3 people who go to the hospital with a heart attack turn out to be diabetic or on their way to becoming diabetic. Can diabetes be cured? People with type 2 diabetes can fix the things that are wrong with their diabetes without taking medicine. They can do this by making changes to their lifestyle. But if the patient's metabolism is put under a lot of stress by things like drugs, a serious illness, an accident, adding weight, stopping exercise, getting older, etc., they're more likely to get high blood sugar again. Because of this, we think that diabetes can be well controlled or in remission, but we don't use the word cured. Also, people with type 1 diabetes who have had a good pancreas or islet donation and no longer need insulin treatment are not thought to also be cured. The reason is because the patient's immune system could refuse the graft or reattack the islet tissue that was transferred. This could cause the diabetes to come back in the future. The impact of bariatric surgery, weight loss surgery, which either includes methods to stop food from going into the stomach or to skip the stomach and upper intestine, lowering food intake, may be the closest we've come to finding a real fix for diabetes. Up to 80% of people with diabetes who had a bypass surgery were cured for up to 10 years. In the future, this could become a norm for curing type 2 diabetes. How diabetes affects various races. People of European descent who are not Hispanic are less likely to get type 2 diabetes than people of other races and ethnicities. The situation is different when it comes to type 1 diabetes, which is most popular in Finland, Sardinia, and Kuwait. A person's genes has a bigger impact on whether or not they get type 1 diabetes than their lifestyle. But lifestyle choices plays a major role in the development of type 2 diabetes. In some environments, People of some ethnic groups may have a much higher chance of getting type 2 diabetes than people of other ethnic groups. The Pima, an Arizona-based native group, are a good example. Half of the Pima have type 2 diabetes, which is different from their genetically linked cousins in Chiapas, Mexico, who also choose to live outside of cities. In people who genetic predisposed to type 2 diabetes, gaining weight and not being active are the two most common and important risk factors. Chapter 2. Are the two types of diabetes mutually exclusive? When a patient displays signs of both diseases, we seldom establish a dual diagnosis. However, those with type 1 diabetes may be just as vulnerable to metabolic complications as those with type 2. In other words, if persons with type 1 diabetes gain weight, become less active, or are members of an ethnic group at high risk of acquiring type 2 diabetes, they may develop insulin resistance and find it more difficult to manage their diabetes. They may also develop metabolic difficulties such as high blood pressure and excessive cholesterol and other blood fat abnormalities, which are common in persons with type 2 diabetes. Their already high risk of cardiovascular disease will also be exacerbated. Some people with type 2 diabetes may have type 1 diabetes because their insulin-producing pancreatic cells have been destroyed. This disorder is known as latent autoimmune diabetes in adults, LADA. What is prediabetes? Prediabetes indicate abnormalities in plasma glucose levels that are not fully diagnostic of diabetes. There are at least two convincing reasons to diagnose prediabetes. The first is that prediabetes is associated with an increased risk of developing full-blown type 2 diabetes. And the second is that prediabetes, particularly IgD prediabetes, is associated with a significantly increased risk of cardiovascular disease and death. Early diagnosis is very important because knowing you have prediabetes allows you to be properly evaluated and treated sooner rather than later, lowering your chances of acquiring full-blown diabetes. Weight and diabetes. The risk of acquiring type 2 diabetes is directly proportional to one's BMI. Body mass index, BMI, is a formula used for diagnostic reasons to assess the connection between weight and height. In the United States, the normal range for a body mass index, BMI, is between 18 and 25, with a BMI of 25 to almost 30 signifying obesity. Obesity is defined as having a BMI of 30 or higher, and severe obesity as having a BMI of 40 or higher. Overly obese people have a BMI of 40 or more, placing them at high risk for a number of health problems now and in the future. To calculate your personal BMI, multiply your weight in pounds by the square of your height in inches. For example, if you are 68 inches tall and weigh 148 pounds, your body mass index, BMI, is calculated as follows: 148 divided by 68, 68 multiplied by 705, or 22.6, equals 148 divided by 4,624, is equal to 0.032. Diabetes is more than 100 times more likely in extremely obese women and approximately 50 times more likely in very obese males. This is because being overweight increases the likelihood of developing insulin resistance, a major risk factor for type 2 diabetes. Despite the fact that exercise has a protective effect, very physically active persons who are overweight or obese by conventional standards may be at slightly increased risk. Can regular exercise help me prevent having type 2 diabetes? Frequent moderate-intensity exercise lowers the chance of acquiring type 2 diabetes. Exercise improves insulin's capacity to remove glucose from the bloodstream through lowering insulin resistance. People with prediabetes who exercise may either prevent their blood glucose levels from increasing into the diabetic range or bring them back down to normal. Blood glucose levels fall during exercise as a consequence of using up glucose stored in the working muscle as starch, glycogen, and the subsequent need to replace these stores. Although it is less definite that exercise helps with weight loss, it does help with maintaining a healthy body weight and preventing weight gain that may lead to diabetes. The major way to lose weight is to reduce calorie intake. Exercise is essential for losing weight. It also minimizes the impact of other risk factors that, when combined with diabetes, contribute to vascular disease. Exercise improves blood lipids and cholesterol levels, lowers blood pressure, and strengthens the heart and blood vessels, among other things. Things you can do to reduce your chances of having diabetes. Certain medicines may reduce the likelihood of developing type 2 diabetes, but this cannot be done with type 1 diabetes. When treating high blood pressure in a diabetic patient, consider utilizing a treatment that has been shown to minimize progression to diabetes in individuals at high risk rather than a treatment that may potentially accelerate progression to diabetes. People at high risk of acquiring type 2 diabetes, primarily those with prediabetes, may use type 2 diabetes drugs to prevent or postpone the onset of the illness. To be considered a useful preventive treatment, the medication must do more than merely lower blood sugar levels. It must also change the course and development of the underlying disorders that contribute to the illness. It is critical to emphasize the need of exercising great care when providing oral anti-diabetic medications for this reason. The risk-benefit ratio has not been thoroughly investigated by the FDA or other competent bodies to recommend their use in prediabetes. Is it possible to reduce my chance of acquiring type 2 diabetes via my diet? The single most significant element in lowering the risk of acquiring type 2 diabetes is the calorie level of a diet. If caloric intake exceeds calorie utilization in the absence of any moderating factors, excess calories will be deposited in the body's energy storage compartment, which is, of course, fat tissue. As a result, maintaining a good calorie balance in diet is the greatest method to prevent acquiring extra weight and getting diabetes. To lose weight, people who are overweight must eat less calories than their bodies need on a daily basis. Even a few pounds lost may make a significant effect. Even before considerable weight loss occurs, the benefits of a calorie deficit may be noticed almost immediately. High-fat, high-calorie foods like cheese, ice cream, fried foods, and processed meats are common dietary contributors to excess weight, obesity, and type 2 diabetes. Despite the fact that sugar alone does not cause diabetes, foods rich in refined sugar, such as sodas and sweets, are more likely to be connected to weight gain and diabetes than those high in natural sugars. When natural sugars are mixed with fiber, their digestion and absorption are delayed or prevented totally. As a result, refined sugar-rich meals contain more sugar calorie. Since the global epidemic of diabetes is clearly linked to weight gain, with some population groups being more susceptible than others, dietary attention should still be directed towards consuming a healthy diet that provides the recommended amounts of important nutrients, in quantities necessary to maintain a healthy weight and prevent undesirable weight gain. Chapter 3. Stress and Diabetes. People react to and perceive stress in dramatically diverse ways. What bothers one person may not bother another at all. This makes obtaining precise assessments of stress levels in the field difficult. Accepted stress may be intentionally quantified via electric shocks or sleep deprivation, but these procedures have a high practical barrier to entry. Those who report experiencing greater stress, regardless of the cause, are more likely to acquire diabetes. Also, it has recently been shown that visible physical and psychological stress, such as that caused by sleep deprivation or social stress, is more likely to be associated with diabetes prevalence. This may help to explain why people with the same genetic makeup and observable physical characteristics, weight, amount of activity, etc., have such disparities in diabetes prevalence throughout the globe. It is unclear how stress, whether physical, social, or psychological, contributes to the development of diabetes. In addition to being overweight, having a family history of the illness, not exercising frequently, and taking some medicines may increase the risk of diabetes. Among these medicines, steroids, also known as glucocorticoids, such as prednisone, methylprednisolone, hydrocortisone, and dexamethasone, are the most strongly associated to an increased risk. Steroids are a sort of naturally occurring hormone, known as a counter-regulatory hormone, and they assist the body prepare for stress. They stimulate insulin production. Catecholamines, adrenaline, and noradrenaline, for example, are another kind of stress hormone that raises blood sugar levels. Some weight reduction drugs, antihistamines, allergy meds, asthma medications, and stimulants are synthetic versions of these substances that may also boost blood sugar levels, despite the fact that diuretics such as thiazides may sometimes cause blood sugar spikes. Diabetics use them often and correctly. Niacin, a kind of cholesterol-lowering drug known as statins, has been connected to severe blood sugar rises. This is less likely to happen with extended-release niacin. Atypical antipsychotics are a kind of psychiatric medication that has been related to an increased risk of diabetes, albeit this seems to be due mostly to the weight gain that these medications produce. Some antiviral medications, particularly those used to treat HIV/AIDS, have been related to type 2 diabetes. Before any of these treatments are administered to a patient, the prescribing physician must assess the risk of diabetes against the possible benefit of the treatment in question. That if diabetes develops, blood glucose levels should be monitored and treated as required, since the potential benefit of utilizing these medications, which may save lives, is regarded to exceed the risks. Is there anything I can do to prevent my children from getting diabetes? There is presently very little that can be done to reliably reduce a person's chance of acquiring type 1 diabetes. However, the incidence of type 2 diabetes in children and adolescents has increased dramatically in recent years, and it is clear that this is due, in major part, to childhood and teenage obesity, as well as a lack of regular exercise. As a result, the most effective technique of avoiding the development of diabetes is to instill in children a balanced eating pattern that avoids excess calorie intake, and to promote frequent exercise. Not only should youngsters follow this practice, but adults should also endeavor to establish in their kids a value for a balanced food and an active lifestyle. With this, they will be less likely to acquire diabetes later in life. Is it possible to prevent diabetes with vitamins, minerals, or other natural remedies? Some research shows that some chemicals may have the power to postpone or prevent diabetes by positively impacting blood sugar levels. Raw walnuts, green tea, and certain chromium, zinc, and vanadium components may provide some help. While the overwhelming majority of these compounds' mechanisms of action are unknown, it is probable that the metallic compounds help in insulin release or insulin responsiveness. The majority of these substances have a minor influence on blood sugar levels, but they may still have an effect. Low vitamin D levels have also been related to an increased risk of diabetes development. But there's no research that proves whether or not vitamin D supplementation will help prevent diabetes. Chapter 4. Signs and Symptoms of Diabetes. The typical and early symptoms of diabetes are caused by the kidney's reaction to high blood sugar, which causes them to remove fluid from the tissues. Because of this, you may urinate more often and pass more urine. A person with diabetes will be able to preserve their health if they can consistently drink enough water to quench their thirst. However, if one doesn't have unlimited access to fluids, which may occur for a variety of reasons, they will get dehydrated, which will make them feel lightheaded when they get up, tired, confused, and, in severe situations, pass out and become unconscious. Due to the fact that their bodies are draining essential nutrients out of their systems in the form of glucose in their urine, patients with severe hyperglycemia often report feeling hungry and losing weight. However, it's important to emphasize that only a tiny portion of people with diabetes have these symptoms. It is significantly more typical to have moderate hyperglycemia, in which little sugar is discharged in the urine and no obvious symptoms appear. However, even moderate forms of diabetes may affect a person significantly and lead to serious chronic issues. Since it is vital to diagnose asymptomatic diabetes, screening programs to detect diabetes in those at greatest risk have been developed. Patients who have been asymptomatic for a long time, months to years, may have long-term effects of undetected diabetes, such as heart attack, stroke, heart failure, neuropathy, nerve damage, nephropathy, kidney damage, and retinopathy eye damage. How doctors diagnose diabetes. The American Diabetes Association, ADA, in the United States established the standard, which is mostly acknowledged by healthcare providers, insurers, and service providers for diagnosing diabetes. It is not necessary to fast before obtaining a blood glucose measurement, but your doctor may still decide to do a standard oral glucose tolerance test, which lasts for 2 hours. Unless the findings are plainly and indisputably incorrect or followed by typical symptoms of diabetes, the results should be verified on a separate day, since a diagnosis of diabetes has far-reaching implications and requires lifetime monitoring and treatment. It's also expected that hemoglobin A1C testing, often known as HbA1c, which assesses the average blood glucose over the preceding 3 months, would soon be used as a routine test for identifying and diagnosing diabetes. The majority of pregnant women should be tested for gestational diabetes between the 24th and 28th week of pregnancy, or earlier if at high risk or had diabetes in a previous pregnancy. An hour-long non-fasting screening test is the initial stage. A 3-hour in-depth test will be arranged if the preliminary examination yields favorable results. Hypoglycemia, the reverse of high blood sugar, or hyperglycemia, which is characteristic of diabetes, is low blood sugar level, or hypoglycemia. Both diabetes drugs may cause hypoglycemia. Young individuals in otherwise good health make up the great majority of hypoglycemic patients. Girls are more likely than boys to encounter this kind of hypoglycemia. Thankfully, it is usually curable by altering the meal's composition and time. If you are one of the few individuals who need further assessment and referral to a specialist due to your hypoglycemia, your doctor will be able to let you know. Hypoglycemia can be a precursor to diabetes. This kind of hypoglycemia may occur in pre-diabetic individuals who are resistant to the effects of insulin but are still able to mount a strong pancreatic insulin release. After a meal, insulin levels may stay high even while blood glucose levels are declining quickly. Typically occurring 3 to 5 hours after eating, this may result in a brief, but sometimes upsetting bout of low blood sugar. This issue often goes away if the prediabetes progresses to full-blown diabetes, while it sometimes may remain for years. A change in diet or other measures are often used to cure it. It's also important to know that diabetes may be present for months or even years without the sufferer being aware of it. However, people with type 2 diabetes may not be aware of their condition until they start to experience some of the symptoms we have mentioned earlier. Studies show that type 2 diabetes often develops over a long period of time before being diagnosed. It is essential to diagnose diabetes in time since, if unchecked, it may have disastrous and even irreparable implications on a person's health. At the time of diagnosis, around 1/3 of diabetics already had discernible neuropathy, nerve damage. Much less commonly, damage to the kidneys, nephropathy, and/or eyes, retinopathy, is discovered at the time of diagnosis. In the United States and a large part of the industrialized world, diabetes is the main cause of blindness and renal failure in individuals of working age. Major problems including heart disease, stroke, and amputation are more likely to occur when diabetes is undiagnosed and untreated. In fact, it is common to find diabetes or prediabetes in almost 4 out of every 10 individuals who are brought to the hospital with an unanticipated catastrophic cardiac event. Chapter 5. What may happen if you don't manage diabetes properly? If hyperglycemia is neglected for a long time or is really severe, significant blood chemistry abnormalities may result in coma and death. However, this is a rather uncommon cause of mortality for those who have diabetes of any sort. The majority of diabetics should be more worried about the negative consequences of poorly managed diabetes. This is because of the dangerous and potentially fatal nature of acute decompensation of diabetes, which has a high mortality rate if not detected and treated in time. Long-term effects of insufficient diabetes management can result to damage to the micro and macro vessels of the circulation. Approximately 1 in 3 diabetics have nerve damage, neuropathy, at the time of diagnosis, and more than 7 out of 10 have it at the time of death. The most prevalent manifestations are diabetic kidney disease, nephropathy, the leading cause of severe kidney failure requiring dialysis or transplantation in working-age adults in the United States, and diabetic eye disease, retinopathy, the leading cause of blindness in working-age adults in the country. When retinopathy and nephropathy reach an advanced, irreversible stage that requires vision loss and renal dialysis or a transplant, their symptoms may not become apparent for some time. Diabetes neuropathy is often accompanied with loss of sensation, particularly in the feet, which increases the risk of foot and leg injuries, infections, and amputations in the patient. Heart attacks, strokes, and lower limb amputations are often caused by diabetes due to damage to the body's main blood vessels. Nearly 66% of diabetics have vascular disease as their primary cause of mortality. The good news is that research has shown that effective diabetes management may halt or slow the onset of many of these serious illnesses. What additional illnesses am I at risk for if I have diabetes? A frequent consequence of type 1 diabetes is damage to the thyroid gland, Graves' or, much more often, Hashimoto's disease, the adrenal glands, Addison's disease, and other organs. Fortunately, the likelihood of developing one of these additional conditions is minimal, but it may be higher in certain families. Thyroid illness, which affects around 1 in 3 patients with type 1 diabetes, is an exception to this rule. Most people with type 1 diabetes usually get a thyroid condition test once a year. Diabetic coma. Diabetic coma is a state of unconsciousness brought on by high blood sugar levels. Both type 1 and type 2 diabetes may result in comas, but type 1 diabetes may also be accompanied by extra blood chemistry abnormalities. These additional aberrations are brought on by the almost complete lack of insulin in type 1 diabetes. Because of this, people with type 1 diabetes may have blood sugar readings as low as the hundreds, but those with type 2 diabetes often have values in the thousands when they enter diabetic coma. In persons with type 1 diabetes, a diabetic coma can only be brought on by low levels of insulin in the blood, for example, forgetting to take insulin. But in people with type 2 diabetes, additional stress on the body, such as an infection or dehydration, is nearly always present at the time the coma develops. If the serious blood chemistry abnormalities that produce the diabetic coma are not promptly addressed, it may lead to death. Type 1 diabetes-related comas may be identified early if the patient shows symptoms of nausea, vomiting, and abdominal pain. In the early stages of coma in type 2 diabetes, extreme dehydration makes the abnormalities of brain function and consciousness more obvious. Even though it only occurs in a tiny fraction of diabetics, coma is a medical emergency that has to be attended to right away since it may be lethal. Diabetic neuropathy. Diabetic neuropathy is the term for nerve damage brought on by untreated or badly managed diabetes that normally worsens over time. When this occurs, a series of events cause damage to or destruction of the small blood arteries that transport blood from the spinal canal to other areas of the body. The longest nerves are the most easily broken, similar to lengthy chains. A peripheral nerve is a nerve that emerges from the spinal cord and runs down the body to the feet. At regular intervals throughout the length of each peripheral nerve, blood is delivered. The nerve fibers in that location will die and lose their ability to conduct impulses in either direction if even one of these capillaries is damaged. Even if there may be a large number of nerve fibers in one place, symptoms won't show up until a sizable number of them are damaged. Unsurprisingly, the longest nerve fibers, which supply the parts of the body farthest from the spinal column, are the most often damaged. Thus, diabetic neuropathy most often affects the hands, feet, and male genitalia. While numbness and unperceived injury, due to a lack of protective feeling, are instances of impulse loss, pain, burning, and strange sensations like bunch socks under the feet, are also examples of damage responses of non-fatally damaged nerves. Patients may experience burns and puncture wounds without being aware of it. There are, however, several uncommon forms of diabetic neuropathy that may manifest as pain, numbness, and other unpleasant sensations in almost any area of the body. Diabetic retinopathy. Diabetic retinopathy is the medical term for uncontrolled or inadequately managed eye damage brought on by diabetes. If left untreated when it reaches its full state, it may result in quick and severe vision loss or blindness. Diabetes is the main cause of blindness among people in working age in the United States, taking away more than 20,000 people's sight every year. All diabetics should regularly have their eyes checked or have retinal photos done to look for symptoms of this illness. When type 2 diabetes is diagnosed, retinopathy should be checked. When type 1 diabetes is diagnosed, retinopathy should be checked between 3 and 5 years later. This is due to the fact that it is sometimes difficult to determine precisely when type 2 diabetes first appears, since it may go undetected for months or even years. The time between suggested follow-up meetings will depend on the findings and the steps taken to address them. For example, if no retinopathy is seen, a second test may be recommended in 2 years. But if there are severe abnormalities that call for active treatment, a third or subsequent inspection might be necessary in 3 months. It has been shown that blood sugar management is directly related to how quickly diabetic retinopathy develops. Also, your chance of acquiring diabetic retinopathy is increased if a close relative of yours did. Controlling blood pressure may reduce the growth of retinopathy, and treating cholesterol issues can completely halt it. Quitting smoking may delay the development of diabetic retinopathy. Therefore, in order to properly prevent retinopathy, it is crucial to treat each of these conditions carefully. Another thing to bear in mind is that diabetics might have eye damage other than retinopathy. Numerous eye conditions such as glaucoma, increased intraocular pressure, and cataracts, opacity of the lens of the eye, are made more likely by diabetes. Therefore, it is required to periodically undergo a comprehensive professional eye test. Diabetic nephropathy. Diabetic nephropathy is the term used when diabetes results in kidney damage. Diabetes-related high blood sugar levels may cause some chemicals stuck in the kidney's filtration mechanism to proliferate, which can cause direct kidney damage. This growth damages the delicate kidney cells in charge of filtering waste. These changes can cause proteins that the kidney typically retains or reabsorbs to start leaking out. Blood pressure might rise as a result of fluid overload and peripheral blood vessel constriction. If there is a significant loss of protein shortage may result in widespread puffiness and edema. A kidney transplant or dialysis procedures like hemodialysis or the less complex peritoneal dialysis, in which waste products are exchanged for fluids injected into the abdominal cavity, may be necessary when the kidney's capacity to filter blood and eliminate waste products deteriorates with time. Complete kidney failure is the main cause of kidney failure among adults of working age, while being a relatively rare consequence of diabetes that nevertheless affects over 25,000 individuals yearly in the U.S. Treatment for kidney failure is highly costly, and patients' quality of life is greatly reduced. Since diabetic kidney damage is heritable, having a blood relative who has the ailment increases the likelihood that one will also have it. However, their effects may be reduced or completely avoided when the proper medication is used. It has been discovered that using drugs called angiotensin-converting enzyme (AC) inhibitors or angiotensin receptor blockers (ARBs) greatly slows the development of diabetic kidney damage. Diabetes and the risk of vascular disease. People with any kind of diabetes have a higher risk of developing heart disease, stroke, and peripheral vascular disease, which affects the blood vessels in the limbs, due to their increased body fat and reduced physical activity, which both contribute to the development of cardiovascular issues. Type 2 diabetics are at an elevated risk for vascular disease. If none of these risk factors are well treated, the risk of vascular disease remains high. Most importantly, we now know that systemic inflammation may be attributed to both diabetes and obesity as irritants to the body's tissues. We can monitor high quantities of compounds in the blood that indicate inflammation. When this inflammation lasts for a long period, inflammatory cells are pulled out of the circulation and into the vessel lining. Additionally, cholesterol takes on an inflammatory form, penetrates the lining of blood vessels, and draws in more inflammatory cells from the circulation, setting the framework for significant injury. High blood pressure brought on by nephropathy damages blood vessels, adding still another element to the onset of vascular disease. This creates a vicious cycle where the blood pressure keeps rising and the kidneys keep being hurt. Even short spikes in blood sugar, such as those that occur after meals, may impair blood vessel function in people with diabetes, and even those with prediabetes because they make the blood vessels more sticky, agitated, and unable to relax. It is unclear if these many, brief bouts of high blood sugar are a factor in long-term vascular damage. However, the risk of vascular disease is higher in those with prediabetes. Chapter 6. Can diabetes be controlled with only diet and exercise? While diet and exercise are crucial methods for controlling type 1 diabetes, they also work well for type 2 diabetes. Insulin therapy is the cornerstone of treatment for type 1 diabetes due to the severity of insulin deficiency. Even though type 1 diabetics need drugs and insulin, a nutritious diet and regular exercise may help improve overall health. Type 2 diabetes is mostly caused by inactivity and weight gain. Thus, addressing these issues via diet and exercise may effectively stop the illness in its tracks. Losing weight may significantly decrease or even eliminate the need for prescription medications for many people, including those who have been receiving insulin injections for a number of years. It has been shown that bariatric surgery may cure diabetes and do so for a number of years as long as the weight reduction is maintained. So losing weight can actually help control type 2 diabetes. Your muscles burn fat when you exercise, making your body more responsive to the effects of insulin. The muscles then replace this energy by drawing glucose and other energy sources from the blood supply. Although this process may occur to some extent in the absence of insulin and physical activity, it is significantly accelerated when muscles are trained by regular exercise and appropriate insulin levels are present. Additionally, when dieting is effective, exercise helps prevent regaining the lost weight. Diet and exercise are always beneficial, but the longer diabetes has been present, the less successful they are as a solution. However, as we are all aware, there are many challenges to effectively managing diabetes with diet and exercise in today's world. Thus, sustaining weight reduction by food and exercise alone is more of an exception than a norm. What should I consume and what should I avoid? Sugars and carbohydrates are often to blame for blood sugar increases after meals. Such meals include fruits, vegetables, beans, peas, bread, pasta, rice, potatoes, and maize. These carbohydrates may be somewhat reduced to help with post-meal glucose control. When deciding how much carbs are appropriate to consume, professional advice should be sought since too stringent a limitation of these meals may also be dangerous. By avoiding fried meals and fatty meats like ground beef, sausage, bacon, and hot dogs and substituting healthier cooking oils like canola and olive oil, lard, and butter, you may lower your cholesterol levels and perhaps even lose weight. For those with high blood pressure, cutting down on salt consumption is important. By eliminating canned and jarred foods, unless they have decreased sodium content, and consuming less salt, you may lower your blood pressure. Fresh or frozen meals are your best choice if you're seeking to reduce your salt intake. Reduced consumption of certain high-calorie items, such as refined sugars, processed meats, and fats, may help people lose weight. Increasing your consumption of low-calorie foods like vegetables may increase your feeling of fullness and decrease your desire for unhealthy snacks. To determine whether you are receiving enough of these nutrients, you should examine the food label. Which diabetic medications are the safest and most effective? There isn't a best or safest medication for treating diabetes that applies to everyone due to individual differences. Therefore, a number of patient-specific considerations must be taken into consideration by the prescribing physician before suggesting an OAD or OAD combination. Although each patient's treatment must be selected individually, there are certain generalizations that may be established. For example, the more recent DPP-4 inhibitor OADs sitagliptin and saxagliptin, which are OADs, do not seem to interact with other medications and do not seem to have any major adverse effects, although saxagliptin may alter the plasma levels of several medications and should be avoided or taken with care while taking these. Although sitagliptin has been associated with severe allergic responses in a tiny percentage of users, this is insignificant when compared to the drug's entire user population. Although many different oral hypoglycemic agents, OADs, are equally effective, their efficiency varies depending on when they are administered in the course of diabetes. After a certain period of time in use, certain OADs fail more often than others. In addition to their impact on blood sugar, certain OADs, including pioglitazone, may decrease blood pressure, improve cholesterol levels, and perhaps even reduce the incidence of heart attacks. Together, these findings imply that various diabetes patients would benefit from using diverse combinations of oral hypoglycemic drugs, OADs, on tablets and insulin. Currently, all people with type 1 diabetes must use an insulin pump or an injectable method to administer their insulin. The reason is because in a person with type 1 diabetes, insulin production can only be re-established by injecting insulin directly. With the use of a single diabetes pill or a combination of diabetes medications, the majority of individuals with type 2 diabetes may maintain normal blood sugar levels for an extended period of time. The majority of oral diabetes drugs act by boosting the body's ability to produce insulin or by making tissues more sensitive to insulin's effects. Patients often use both types of drugs together. In the United States, there was only one class of diabetes medications available a little more than 10 years ago. There are now at least 6. Therefore, by combining them, people with diabetes may be able to remain off insulin for longer, even for many years. People with type 2 diabetes often need insulin therapy, soon even without significant weight gain. About 1 in 5 people with type 2 diabetes may actually have a partial form of type 1 diabetes, which is known as latent autoimmune diabetes of the adult LADA. Insulin treatment is often more successful than tablet therapy for LADA patients. Chapter 7. Blood pressure and cholesterol. Diabetes patients are more likely to develop vascular disease due to their high blood pressure and unusual lipid levels. According to several studies, maintaining healthy blood pressure and cholesterol levels might protect your tiny blood vessels from illness more potently than maintaining healthy blood sugar levels. The significant effects of tiny blood vessel damage on the eyes, nerves, and kidneys have been shown to be minimized by treating cholesterol and blood pressure. Blood sugar management may be aided by certain drugs used to treat various conditions, but it may also be harmed by others. Your doctor will choose cholesterol and blood pressure medications that will either help you regulate your blood sugar levels better or at the very least prevent things from becoming worse. How do basal and bolus insulins vary from one another? It is always necessary to take in a certain amount of insulin to keep blood sugar levels within normal range. Because their systems cannot effectively break down carbohydrates, fats, and proteins without insulin, people with type 1 diabetes have major health consequences. To fulfill their basal requirements, the amount of insulin their bodies need even when they aren't eating, the majority of patients inject themselves with long-acting insulin once or twice each day. The basal setting takes care of this if a person is using an insulin pump. A healthy person's basal insulin production varies throughout the day, with peaks often occurring 2 to 3 hours before waking up in the morning. For this reason, contemporary insulin pumps provide a variety of basal settings each day. The insulin dosage required to get glucose from the circulation into the tissues after a meal, where it may be utilized to replenish glycogen reserves, is known as a bolus. This is often accomplished by using the bolus setting on an insulin pump or short-acting insulin injections before meals. A variety of bolus administration rates and patterns are offered by modern insulin pumps to meet foods that are absorbed fast or slowly. Basal insulin, bolus insulin, and supplemental insulin are given in an attempt to mirror the body's natural insulin release pattern. Because the body cannot distinguish between glucose from meals and glucose from the basal state once insulin is delivered to the body, different kinds of insulin preparation will overlap in their effects. How successful are over-the-counter diabetic treatments? Numerous over-the-counter medicines have been shown to significantly lower blood sugar levels. The French lilac plant's leaves have been known to relieve some patients' diabetes symptoms for more than 2 centuries. As a result of this knowledge, the drug metformin, one of the most well-known and well-established treatments for diabetes, was isolated and chemically modified. Raw walnuts, bitter melon, cinnamon. It appears that the cinnamon stick itself must be used rather than just powdered cinnamon, and various compounds of the metals chromium and zinc have all been proven to be beneficial to varied degrees. Trying out any of these supplements often has minimal negative effects as long as glucose levels are regularly monitored and conventional medications are used as necessary. These products are not regulated or labeled by the FDA, therefore their content varies greatly from one manufacturer to the next. Diabetes medications may be taken in any sequence, but there are a few important guidelines that must be observed. The guiding principle is that each patient's requirements must be met via customized treatment. There is usually a prescription or pharmaceutical combination that would be helpful, yet it would be hard to say that any one medication would be the best option for every patient. The drug of choice for many diabetics is metformin since it is efficient, secure, and does not cause weight gain. In fact, it may even encourage minor weight reduction. However, owing to its unfavorable side effects, it is contraindicated in persons with a broad variety of medical illnesses, including liver and renal disease, as well as certain types of significant lung and heart problems. Sulfonylureas are often used following metformin despite the fact that they might result in hypoglycemia and weight gain. Because of this, sulfonylureas are used much less often than they need to be. As the cost of safer alternative pills declines over time, they will probably be used even less frequently. DPP-4 inhibitors, such as sitagliptin, are a costly family of diabetic drugs that do not cause weight gain or low blood sugar levels, but are also safer, more practical, and more successful. Thiazolidinediones, TZDs or glitazones, are effective and do not cause low blood sugar. Nevertheless, due to the risk of weight gain and fluid retention, they are not advised for patients with heart conditions or those at high risk for developing it. They are also rather expensive. Although they are not often utilized at first, other drug types including meglitinides and alpha-glucosidase inhibitors have a role in the treatment of diabetes. It has been shown that combining sulfonylureas and meglitinides is no more effective than doing so alone since they both release insulin via a comparable mechanism, although by activating it differently. Chapter 8. When should I check my blood sugar level? People with diabetes are often advised to routinely check their blood sugar levels. All diabetics, with the exception of those who cannot or will not test, should be ready to check their blood sugar levels often while unwell, physically worn out, or using drugs known to have a major impact on blood sugar levels, such as steroids. Your unique traits and present state of health should be taken into consideration when choosing your blood sugar target. When feasible, People with diabetes who are otherwise healthy should try to maintain blood sugar levels that are as near to normal as possible, given that doing so does not put them in danger. The ideal blood sugar levels may be described in more general terms using hemoglobin A1C, HbA1c, or A1C, an average measure of blood sugar over the previous 3 to 4 months. All people with diabetes should have their HbA1c levels checked at least twice a year. How can stress affect my blood sugar levels? Emotional stress may affect blood sugar levels in a variety of ways. Blood sugar levels increase as a result of the body releasing glucose from its reserves in response to stress hormones, including epinephrine and cortisol. Additionally, they make tissues more resistant to insulin. Stress has an impact on eating behaviors that extends to blood sugar control. Stressful situations can cause dietary habits to change. In a certain situation, this change but quite different from person to another. The usual fluctuation of one's blood sugar levels may change significantly as a result of one's eating habits, which can also be caused by stress. Stress also has a tendency to interfere with normal exercise and leisure schedules, which might raise blood sugar levels. Also, managing diabetes can be stressful in and of itself. Due to this, a lot of diabetics quit taking the insulin that is recommended to them or reduce the number of times each day that they check their blood sugar levels. It is in your greatest long-term benefit to concentrate on minimizing the stress if you have diabetes. Sleep and blood sugar levels. Lack of sleep has been shown to have a deleterious effect on a number of metabolic factors, including blood sugar, blood pressure, and cholesterol. Lack of sleep stress may cause blood sugar levels to rise. Since what constitutes getting enough sleep varies from person to person, not everyone will have the same definition of what a metabolic stress is. Blood sugar levels might increase at any time of the day since stress hormone levels often increase throughout the day. Blood sugar levels are raised by stress hormones. But not sleeping for a few times wouldn't affect blood sugar levels. Sleep deprivation may need to continue for many days in order for blood sugar levels to shift in a discernible way. There are other factors to take into account. The additional physical activity may aid in lowering blood sugar levels if sleep loss induces restless behavior, such as tossing and turning or getting up and pacing. Obstructive sleep apnea, OSA, is a disorder that is more likely to occur in people who are overweight and have type 2 diabetes. This could result in difficulty falling asleep at night and excessive daytime sleepiness. Depression and diabetes. People with diabetes and other chronic diseases are more likely to experience depression. This might happen for independent or connected to diabetic causes. There is little evidence that blood sugar levels are a reliable indicator of mood, even in those who are prone to depression. The length, intensity, and complications of diabetes, as well as how much these problems have changed the person's objectives and way of life, are all major depressive disorder risk factors. Diabetes affects everyone in the same way, yet its severity varies from person to person. More than 15 million people in the United States alone have diabetes, yet with the right care, the majority of these people are still able to enjoy happy lives. If you have unusually high levels of depression, have lost interest in life, or experience excessive stress that you perceive to be connected to your diabetes, your doctor or a trained diabetes educator may be able to lead you towards services that might assist you in dealing with these issues. Sugar found in fruits and soda. Since fructose, the main sugar found in fruit juices, is a disaccharide, which must first be broken down to glucose for absorption, its impact on blood sugar may be delayed or diminished. The sugar in soda contains glucose, which dissolves faster and has a stronger sweetness. A 12-ounce can of regular soda has the same amount of sugar as around 9 teaspoons of table sugar, which is sucrose, another disaccharide. Soda may quickly raise blood sugar levels. This aids in treating a low blood sugar response, but since it causes a quick rise in glucose levels, it is not recommended for diabetics. Chapter 9. Pregnancy and Diabetes. Planning for pregnancy is particularly important for diabetic women of reproductive age. The first is that the likelihood of a child being born with a deformity, a congenital anomaly, rises significantly if diabetes is not under control before pregnancy. Even if diabetes is strictly controlled as soon as the pregnancy is discovered, this risk, which has been estimated to be as high as 1 in 5, cannot be completely removed. Therefore, it is crucial to determine and confirm that your diabetes is under the greatest possible control before going ahead with a plan to get pregnant. Microvascular problems enhance the risk of a difficult pregnancy in women with long-term diabetes, and they should be reevaluated before and throughout pregnancy. The possibility of diabetic nephropathy and diabetic retinopathy becoming worse during pregnancy is particularly concerning. A change in treatment during pregnancy may be necessary, which may need advanced planning. Taking pills is not advised as during pregnancy. Therefore, if you are a woman with type 2 diabetes, it could be more beneficial to learn how to take insulin before becoming pregnant. Will having diabetes affect my ability to still work a job? Many professions may be unaffected, if at all, by the fact that you have diabetes. You may not be able to do certain occupations that require the public safety. High-risk individuals include those who use insulin or oral diabetic drugs like sulfonylureas or meglitinides. As a result, licensing authorities or your employer may have the authority, or even the obligation, to restrict your ability to perform these kinds of jobs or to impose stringent conditions that must be met, such as frequent verified glucose testing with a low frequency of low blood sugars. You should speak with your doctor and/or a diabetes educator to assess the extent to which you are raising your risk of injury before deciding whether or not to pursue or continue in a particular line of work. Exercise and diabetes. Sports and physical exercise have diverse impacts on blood glucose levels. Blood sugar levels may increase as a result of the stress hormones that the body produces in reaction to strenuous, demanding, or competitive activity. Additionally, isometric activity, which involves contracting or rigidifying the muscle against strong resistance, such as when weightlifting, tends to cause blood sugar levels to rise higher than isotonic exercise, which involves constantly moving the muscle against little resistance, such when running, swimming, or dancing. Maintaining blood sugar levels may be just as important and difficult after exercise as it is during the activity itself. Glucose must be taken out of the circulation and put into the muscle to be utilized as fuel in order for depleted glycogen, muscle starch, to be restored. The best way to manage blood sugar before and after exercise depends slightly on the person. It is often desirable to consume more calories before and occasionally during exercise. Making these preparations is made easier by being aware of your blood sugar levels before, during, and after exercise. In order to account for the replenishment of glycogen reserves over the hours after intense activity, eat a hearty dinner later in the day. People who don't factor in the fact that they'll be working out the night before when planning their meals often discover that their blood sugar is much lower the next morning. Diabetics' wounds don't heal fast. Why? When diabetes is poorly managed and is followed by chronic issues, wound healing may be significantly slowed down. Diabetes' long-term effects are mostly caused by damage to the blood capillaries that nourish the body's tissues and organs. One of these organs is the skin, which might experience unusual but genuine effects from diabetes. For nutrients to reach the cells that provide the protective defense against infection and those that cause inflammation, which are needed for wound healing, there must be a sufficient blood supply. In this situation, inflammation is advantageous because it encourages the removal of old, damaged skin and promotes the development of new, healthy skin and underlying tissue. Second, short-term high blood sugar significantly impairs these defenses in the blood and tissues, making it more difficult for the body to fight off infections and decrease inflammation. How probable is a type 1 diabetes cure? Despite the fact that pancreas and islet transplants can result in independence from insulin treatment and have dramatically improved quality of life for some, they are a limited proposition for most due to the need for risky and expensive anti-rejection drugs and the tendency for late failure. Additionally, there is a critical lack of donor tissues. Although the ability to transform stem cells, early forms of cells with the capacity to differentiate into a variety of different cell types, into insulin-producing pancreatic islet cells has a lot of promise, there are a number of practical concerns that need to be resolved before this can be applied as a common clinical therapy. Since type 1 diabetes is an immunologic disease, altering the immune system may help treat the condition, especially if done at an early stage. How probable is a type 2 diabetes cure? It's quite improbable that one medication or treatment will be able to cure type 2 diabetes. Treatment or prevention of obesity and overweight would be anticipated to provide the added advantage of treating or preventing type 2 diabetes, as being overweight is often a risk factor for acquiring type 2 diabetes, though this varies considerably amongst ethnic groups. Specific kinds of bariatric surgical procedures have been associated with effective remission of type 2 diabetes. But only those who are in the greatest risk are now eligible for this kind of surgical intervention following a bypass operation. Subsequent problems might include low blood sugar, diarrhea, and a chance of malnutrition and nutritional deficiencies. However, a drug that promotes safe, long-lasting weight loss might achieve the same goal, and this efficient weight loss strategy can treat or prevent type 2 diabetes. Hence, surgery is not always advised as the first option for treating type 2 diabetes.